Hello everyone. Hello everyone. Welcome. How are we all doing? So I'll wait a while to see if I will get about 10 people to be watching at the moment so I can start. Okay, we have 4 people now. Welcome all of you watching me. Thank you for joining us. Or thank you for joining me. Okay, so we have about 9 people watching now. I need one more person for me to kickstart. I hope I'm audible enough though. Okay, so I guess I'll just start so I don't delay. Alright, so I'm going to be starting. It's been 2 minutes. Welcome. My name is Fab. And what does Fab mean? It simply means Folisho Adedopo Oluwatike. That's basically my full name. And the nothing behind it is basically because I'm going to be talking everything nursing from preparations to enter to start nursing to how to balance work, academics, and even your social life with your academics, as well as tips and guides to pass your council exam, in which I'm about to delve into, as well as all the difficult courses like anatomy and physiology, pharmacology. I'm going to break it down into bits with time on this platform. Now, for today's focus, which is nursing council exam, paper one. Yes, I'm going to start with it's hard and it's not hard. It's hard if you've not prepared, and it's not hard if you prepare and you are confident and you pray enough, and yeah, you'll be good to go. So I'm going to be projecting the slide so that we can see as we go through. So this is called Ace Your NMCN Examination, a comprehensive guide to success. So if you have any question along the course of this life, you can type it in the comment section. I will be paying attention to it from time to time so that I'll be able to address these questions. So now moving on. What is the mission of this slide? The mission is to ensure that all users that uses this guide would pass their council exam once, because that's the goal. We have to pass this exam. And to also break down complex areas into simpler bits. Yes, there is a lot of things to actually go through when studying nursing. There is each of the courses are actually like bulky. You might not know where to start from and all of that. So this is going to help. And then lastly, to give you exam focused guidance. Yes, so we're just going to go straight to like what exactly it is that you like need. for like the exam. So that is our mission and goal. Now, how do you set up yourself for success? How do you set up yourself for success? It's all about mindset, actually. You have to first of all believe in yourself. There are some people that okay, they will read and then they will start having self-doubt. You don't do that. Try and have belief in yourself first. It's that just have that mindset that I'll write this exam and I'm going to pass. I are good to go. Then the second thing is time management. That is your most valuable asset. I'm telling you. Like to be able to manage your time effectively is a good thing. I'm going to try and be going through some things. Now, for the mindset, you have to cultivate a positive attitude, like I said earlier. Replace any negative thoughts, replace them with affirmations. I'm going to pass. I'm going to do well. I'm going to write this exam once and I'm going to pass. Just keep that attitude. Remind yourself of your past successes. I mean, you must have passed some exams or many exams in the past for you to have gotten to this particular point in your life to say you want to write council exam. You get so you passed. Remind yourself that you actually passed these courses in the past. So therefore, this you would pass as well. Now, self-belief is key. Like I said, you have to just believe in yourself and you have to visualize your success. Imagine what I would do after passing this exam. Just imagine yourself in that situation. That alone, when you're imagining yourself confidently, you'll be able to achieve your desired goal. And then lastly, embrace challenges. View obstacles as an opportunity for growth. So just embrace challenges and make sure that you you know scale through. Now the second point here is time management. That is your most valuable asset. Now, how do you go about this time management of a thing? You have to create a study schedule. You allocate specific times for each of the subjects, and it has to be realistic and flexible. Like, don't say, oh, because I want to read now, you start putting like courses or start giving yourself a very tight schedule. You have to be flexible about it and you have to be realistic. You have in a day, you have to have time to rest. You have to have time to like relax and all of that. So you cannot just say, okay, because I have exam, I have to keep myself anonymous. No, like just allocate specific times for each of these subjects. Now, the second thing you have to do is like you prioritize topics. Yes, there are some topics that you can feel like, oh, I can confidently answer questions on this topic. So the areas where you are not so confident about, that is the one that you actually put in high esteem, in which you're going to like make sure that okay, I should actually focus on this so that I'll be able to, do well in this area. You break down study section using pro Pomodoro technique. That's like where you have focus time and then you take a break in between. Then avoid procrastination. Honestly, like you cannot be procrastinating when you have exam nearby. You can't. And I would strongly advise you that you focus on the difficult subject for you first before you go to the easier part. Then schedule regular breaks. All of this is all about time management. Now, the next thing here is for you to manage stress. Try and be staying calm under pressure. Yes, when you enter the exam setting, there's a lot of pressure that comes with it. So you have to, the thing you tell your patient when they are stressed in that they should practice your relaxation techniques. They should, you know, breathe in, breathe out. Anything that you know that can help you manage stress, please make use of it when you get to the exam hall. Now, study habits. You learn effectively. How do you learn effectively? You test yourself regularly without referring to notes. That's like the process of active recall. Then spaced repetition, where you review materials like from time to time. Let's say you go through something now, like you just read through something. and you try and do this active recall by trying to remember without necessarily going back to what you read. So after you like maybe you've gotten it, go back to it again one more time before you like move on. Now the most important thing here is like try and teach other people. When you're teaching other people, you will tend to remember. You know you will forget because you remember that this was what you said. This is how you said it. It will stick. Then you can use visual aid for people that maybe when they look into a picture or something, or when they idealize it, it helps them. You can create diagram. If it's picture that will help you download it for anything, if it's chat, just try to visualize it. Then take effective notes. Yes. Just be summarizing key points and you're good to go. Now you can also form study groups. So these are like study habits that you can like do. Now, exam strategies. You have to like go through past questions and all of that to be able to master the question types. So if you're able to do that, you would be good to go. Now, the next thing is how to set yourself up for success. You have to know when to start studying. It's not a it's not a new thing that this council exam holds every May and November in the year. So you need to start planning towards it. If you're writing in May, you need to start planning towards it. If you're writing in November, you need to start planning towards it. And how do you do this? 3 to 6 months before the time you're going to write. You can just begin with the general overview of the syllabus. Create a study plan with it. Just create a study plan. Then 2 to 3 months before, you focus on the in-depth core concepts of this overview that you did. Then 1 month before, try and review key topics, practice under time condition. Yes, cancer exam is like timed, so you need to practice under time condition so that you don't spend too much time on a question. And then the final week, please relax. Like you've already read enough. Just try and relax and you can just be doing like light review. You've already done most of the work in the previous months or for the past few weeks. Yes. Then to the next point here, which is daily study hours. Find your reading. Yes. You need to actually know the time you read every day. You you separate your time of rest, your time of socializing, and the time in which you actually want to study. I would suggest that you should ensure that at least in a day you study for about 2 to 4 hours. Focus. And you can use the Pomodoro technique that I mentioned earlier, where you focus for some time, you can take a break, and then you go back to it. So just make sure that each day does not go by without you learning something. Then study environment, creating your sanctuary. Find a quiet place. Make sure that you minimize distraction as much as possible. Minimize distraction as much as possible. Keep your study area clean and organized. This alone will give you the ambience to like say I even want to like read. Okay. Now lastly, how do you set up yourself for success? Material. This is your arsenal for success. There is like an official like NMCN syllabus. I made a research on it on through Gemini. That's like an AI app. So that is where like you can get like all the courses on to know NMCN official syllabus. And you can also search through Google as well. You can see there are various sources online. So when you know that okay, these are the syllabus here, you now look for recommended textbooks and study guides to use to cover this syllabus. Then you might not only resort for only textbook, you can go for online resources that like all these applications that are there to help nursing students. Then flashcards and note-taking techniques too can also help. Like I mentioned earlier, you can make use of visual aid, create your own chart and all of that to be able to read. Now, I'm going to be moving on to the next thing on my schedule, which is mastering the 250 challenge. What does this mean? So, cancer exam, they're in Will I say four? Majorly, there are three. Paper one is objective, paper two is objective, paper three is divided into two, that is the Viva and the OSCE. Now, for the paper one and the paper two, there are 250 objective questions, and you have about 3 hours to answer them. Now, the goal to pass, because many people normally say, okay, you have to go above 50. Yes, that's very true. You have to get 50 and above. Now, the 50 is not the accumulation of from all the three, it's from each of this paper. So for paper one, you need to get minimum of 50%. Paper two, you need to get minimum of 50%. And paper three, you have to get minimum of 50%. Now, for paper one, how do you get 50% from 250 questions? That means you need to get 125 questions correctly. So that means you have, I'll soon break down the timing, that you have about less than a minute on each question. You have less than a minute on each question. So it demands speed and accuracy. Now, this is where time management comes in. I mentioned earlier that you should practice under timed condition. So if you practice under time condition, you would be able to scale through this easily. So now you have to prioritize accuracy over speed. You have to prioritize accuracy over speed. So, and the only way you can go about it is practicing past questions to be able to prepare in advance. Now, the next point is maintain focus, break down the 3 hours. Now, 3 hours is approximately 180 minutes. Now, how do you break down these 3 hours when you get to exam setting? The initial 15 minutes, you can use it to scan and identify easy and hard questions. When you are scanning through, you see any question that, oh, even if they wake you up when you're doing that, wake up, you'll be able to answer the question. So you can answer the question as you're scanning through. Try and scan through all the questions. Then the next 2 hours, focus on answering those questions as accurately as possible. Make sure that whatever you're answering is correct. Then the final 45 minutes, you can use it to review your answer, the ones you did not answer before, you answer them, and all of that. They normally say if you see a question you don't know, you skip. Please, this is this is very important. If you see a particular question, you skip, you come back to it later. You don't waste time on a question because there is no enough time. Now we're going into the main thing, the use of explicit. This is what helped me the most. So after getting that for paper one, these are like the courses where most questions are being asked. Anatomy, physiology, method. We'll soon go into it. I realized that in explicit textbook, the the book will cover anatomy, physiology, method, nursing, and medical management. Now, when I realized that, I first of all prioritized the usage of that textbook. Now, what I did is that for each of the systems of the body inside explicit textbook, there are different diseases. Now, those different diseases, each they comes with the pathophysiology, the nursing and medical management, the drugs, the pharmacological drug. So these are what you take note for each of the diseases. So if you decide that okay, today I want to know everything about respiratory system, carry a textbook. When you get to respiratory system, all the diseases listed under respiratory system, go through it one by one. Note the peculiarity of each of these diseases. That is all this in between line. That is where is always being targeted. And not honesty, like most of my questions came from it. And I was just so happy, honestly. Then for those that joined the group, when I reached out to some of my mates, they mentioned that they made use of one past question, the PDF. It's called Richard's past question. So it's currently on the group. It's currently on the group. So if you want to like, if you are not yet on the group and you want to join, you can still click on the link in my bio and go to the group. I would still, for the sake of newcomers, resend all past questions. So this is for explicit. Now, okay. Now for paper one, the areas in which you're going to see questions from are anatomy and physiology, pharmacology, medical surgical nursing, foundation of nursing, public health care, nutrition and dietetics, community health nursing, home health care, healthcare quality improvement and patient safety, principles of management and teaching. Now, I'm going to take each of these courses one by one. For anatomy and physiology, for anatomy and physiology, the topics that you should be expecting is going to be questions on basic unit of life, which is like cell, the function, alongside the structure and function of the major body system. I would have projected what I'm using right now, but for some reasons, I'm not able to upload that. So I'll just make use of the slide that is projecting. But I will love, like, if you're watching right now, I would love for you to like get your pen and book and paper and pay attention and jot. Okay. So for anatomy and physiology, as earlier mentioned, basic unit of life, which is cell. Know it, know the function, and alongside knowing the function, know the structure, know the function of major body system. Now, systems like skeletal system, know that you will know that that system provides support and structure. Muscular system, you know that one will enable movement. Nervous system, you know that one is responsible for communication and control. Endocrine system, you know that one is regulating hormones. Cardiovascular system is blood, circulating blood. Respiratory system facilitates gas exchange. Digestive system processes nutrients. Urinary system eliminates waste. Reproductive system enable procreation. Integumentary system protects the body. Now, I mentioned the use of explicit. If you make use of explicit for each of these systems, you'll be able to note the diagrams and the label. Then, typical anatomy questions in council, this is how most anatomy question comes about. There would be a picture. There will be a picture where you'll be asked to like label. They will label it. They will label some. They'll be like A, B, C, D. They might not be like, okay, the structure labeled A is what? The structure label F is what? So if you should take note of diagrams under each of the systems and their labeling, you would be able to easily know the areas in which they are asking you to label. So, long story short, that is it about anatomy and physiology. The next area, medical surgical nursing. This is what we mostly like do in clinical setting, infection control, assessment skill, nursing management, pre and post-operative care, pain management, wound care, fluid and electrolyte and acid-base balance. With your um with your experience doing clinical posting, you'll be able to easily ace this, honestly. But key topics that you should take note are what I just listed: asepsis and infection control. How do you go about it? Different area. One thing that you should notice, if you are going to be tested in areas like this, it's going to be like questions like real life setting. Like they might just put it, they'll be like, if Miss so 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 and so 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 is there, like what will you ask? the nurse do if the patient has this? What is going to be your first line of management? So now it's like four different things there. Maybe like call the doctor, um, stop the okay, for example, let's say a patient is reacting to blood transfusion. What's the first thing that you will do? It might be like call the doctor, run and call the doctor, stop the blood transfusion, send the patient packing or something, or tell the relative, or be looking at the patient, like what will you do in that situation? Of course, you have to first of all stop the blood transfusion. Take note that okay, this patient is reacting to it, and then I'll ask the doctor concerning it. But the question here is, what is the first thing that you will do? So yes, the four options can be what you are going to do. It might not be this question I just taken. It might be any question. So the four options might be what you are supposed to do as a nurse, but the question says what is the first thing that you will do. So tricky questions like this is what you are going to see. So if you have an understanding of all these areas in medical surgical nursing, you'll be able to, and trust me, your clinical postings will cover this for you. Because all you just have to imagine is okay, when you were there, what did you do? Or what did the nurse do in your presence? Now on to the next area, which is public health care. So in this area now, levels of disease prevention is important for you to know. So key topics will likely cover the core concept of health and disease, as well as different levels of disease prevention. Now, what are the levels of disease prevention? Primary, secondary, tertiary. Which one for what does primary does to prevent the onset of disease? And that is that vaccination, healthy lifestyle, no smoking, no excess alcohol consumption, good environmental sanitation, things like that. Chemo, I said chemo, sorry. I meant prophy, yeah, chemo. Yes, chemoprophylaxis. This is where medications is used to prevent disease in high-risk individuals. For example, when you take anti-malaria drugs, when you are going to areas that are malaria endemic, so you are preventing the onset of disease in advance. Now, for secondary prevention, this one focus on early detection and treatment of disease to prevent it from progressing and causing more severe problems. So that one is secondary prevention. Now, questions like this can just be like, okay, they might just list out three ways that you can prevent um, disease under secondary, and then the last one might be primary, and then in that be like the following are ways to prevent diseases except or like on through secondary except. So you have to know which one falls under each of the levels of diseases for you to be able to answer that question. Then the basic understanding of epidemiology. What is epidemiology? Epidemiology is the study of distribution and determinants of health-related states or events in specified populations and the application of this study to the control of health problems. So it's like all the statistics to be able to know how to, you know, control disease. Environmental health too, how the environment affects human health. You can also come across questions like that. National health policies and programs, you can be given acronyms for you to like state the full meaning, and or you can be given one national health policy. I mean, one national health policy or program, and for you to just tell us the function of that. So questions like that can come about. Examples of national health policies. We have we have National Strategic Health Development Plan. These ones, they are medium-term plans that translate the goals of the national health policy into specific objectives, strategies, and interventions. It provides a roadmap for health sector. The NHP themselves, which is the National Health Policy, That one provides direction and framework for the development of the health system in Nigeria. It outlines the roles and responsibility of different levels of government, the private sector, and other stakeholders in the health sector. Now, another national health policy. I hope you're taking note of this because it's not in this slide that I'm portraying. It's in this PDF that it's an ebook that we collected. I'm going to talk about this ebook at the end of this teaching. So if you want to have access to it, I'm going to tell you how. Now, to continue what I was saying, we have NPHCDA. What does what does that mean? It means National Primary Healthcare Development Agency. This agency is responsible. Agency is responsible for strengthening primary healthcare in Nigeria. It implements various programs aimed at improving access to essential health services at the community level. We have National Disease, that NDCP, National Disease Control Program. We have National Health Insurance Authority. They were formerly called National Health Insurance Scheme. I just got to know that this afternoon when I was trying to figure out examples of national health policies that you can be asked. The questions like that can come that NHIS was formerly called what? That's National Health Insurance Authority. Now, what does National Health Insurance Authority do? They they provide accessible, affordable, and quality healthcare services for all Nigerians through a health insurance system. I'm coming, please. Messages are empty. Sounds like transfer that for me to focus. It's not canceling me. Okay. So I didn't mention what NDCP was for. It's their major work is to control communicable diseases. Now, moving on to the next aspect that you can see in paper one, foundation of nursing. You cannot escape this. It's your foundation after all. So why will you miss it? You cannot miss it. So likely areas include nursing process. Of course, you will not expect them to ask you that the following nursing process except no, but you might be lucky. But questions on nursing process can come about for you to put it into practice in sense of, like I mentioned earlier rather. You can have a case scenario, then they now want to test your knowledge that what will you do if you are placed in this situation. So that's where your nursing process comes in. And you have to remember how it follows. And you have to read the question to understand which step is next for you to take. Because most times they might have included the assessment and the diagnosis already in the question. And after assessment and diagnosis, what's the next thing? Planning. So in the options, you have to take note of which option suggests planning. So that is how you make use of your nursing process. Now, your effective communication skills in nursing can also come in. This too is also in application to case scenario. Like for example, now let's say a patient relative is maybe asking for their patient, what's it called? Maybe a patient die or something like how let's say patient die. Which example can I use now? Like you can put in your effective communication skills into use. How you communicate with the patient to even agree with you. How you communicate with the relative to even agree with you because hmm, okay. So these are like case scenario questions that will be asked. This is where it is put into use. Your ethical and legal issues in terms of informed consent, confidentiality in that aspect. Now, when the patient relative is asking for like their patient details, and let's say the patient already said don't tell them, don't because they are relatives, you can't tell them. Oh. That's how you have to use your effective communication skills to come into use so that you satisfy the relative and satisfy the patient. Satisfy the patient by not telling the relative and satisfy the relative by, trying to tell them that they should speak with their relative instead so that the patient should tell the relative by themselves in that kind of situation. So all these ethical and legal issues are a big thing in real life nursing. So questions on this can be asked in form of um, case scenario. Then practical basic nursing skills such as patient hygiene and all of that, assisting with mobility, all these things. We've done it. If we've done it in clinical posting, just put it into use because, like I said, it's real life scenario that you'll be given. So let's move from foundation of nursing, nutrition and dietetics. This was my favorite course in school because then I'm I'm slim, but I like food. So I paid attention to like know where and what I can combine to eat to maintain balanced diet and increase in size. But it seems like this hour will be all right. Nutrition and dietetics. You have to know functions of essential nutrients. Yes. After knowing them, know their function within the body. Know the process of digestion, absorption, and metabolism. Now, you might meet questions like digestion of carbohydrates starts from where? Where does it happen? It starts from the mouth. Digestion of protein starts from where? Stomach. Or fat starts from where? Mouth. So when you know that, you are good to go. Then the daily requirement of carbohydrates, protein, and fat in adults are what? For carbohydrates, is 4 kilocal per gram. For protein too as well. And fat, you need 9 kilogram. I mean kcal per gram. So take note of all of this. These are the daily requirements of carbohydrates, protein, and fat in adults. Basic principles of nutritional assessment, like real life case scenario where they can present a child with some symptoms of kwashiorkor or marasmus. I think those are the um, common two that I've seen so far. Majorly because they are similar, but there are differences. So you can put in the knowledge of your nutritional assessment here to be able to know what the question can be, what will you do to improve the nutritional status of the patient, or what can you do to prevent this, the role of nutrition across different age groups. So when you know all of this, you'll be able to know for each, from infancy to old age, how you're going to take care of their nutritional assessment when you're given a real life scenario concerning that. I hope we're following. Okay, I still have people watching. Now, for pharmacology, I think this is what most people are scared of. I'm scared of pharmacology as well. But guess what? I had to read and pass. I had to read and pass, and these were the areas I mostly focused on. There's this book called R.O. Mustafa Pharmacology Textbook. So that textbook helped me to streamline my pharmacology into this. So first things first, know your definition of terms. Yes, you can be asked that this so and so like definition of pharmacokinetics. Yes, you can be asked that dash is maybe what does the body do to the drug, or what does the drug does to the body. Yeah. I use something. I know that pharmacodynamics is what the drug does to the body, while pharmacokinetics is what the body does to the drug. Yes. So it can be dash. Dash It's a term that is used to describe what drug does to the body. You know, it's pharmacodynamics. There are about 11 pharmacological terms. Try and know the definitions of these terms. Now, the reason I single-handedly remove pharmacokinetics and pharmacodynamics is because most people tend to mix it up. So, please, this is how I know. For pharmacodynamics, you know, dynamics starts with D. What drug does to the body? So I know that that one, once I say pharmacodynamics, the D will make me say, oh, drug to the body. I know alternatively, pharmacokinetics is what the body does to the drug. And what does the body does to the drug? ADME. That's ADME. Absorption, distribution, metabolism, and excretion. Those are the four things that the body does to the drug. It absorbs the drug, it distributes it to everywhere, it metabolizes, and then it works for what it's supposed to do. And then the part that you don't need to be excreted. Chicken. Then for you have to also know different drug classification and common medication used in various conditions. Now remember I mentioned explicit earlier. This will solve explicit will solve this for you. So go back to explicit for this part. Different routes of drug administration. The pharmacology textbook would help you with that. Basic drug dosage. There was a form that the early people that joined the group were able to fill. There, some people mentioned pharmacology. Later on, when we scrapped out the form and we asked the question of the group, someone made mention of drug calculation. Yeah, for that one, I've single-handedly like done a deep research on drug calculation, in which after this live stream, I'm going to be forwarding to the group detailed explanation on dosage calculation. Is there the examples, the formulas, everything is inside. But majorly, what I did for most of my calculations was that I did cross multiply. For example, if you are given um if 10 oranges cost 5 naira, how many oranges would 10 buy? 10 oranges equals 5. X oranges equals 10. Cross multiply 5x is equal to 10 times 10, 100. X x is equal to 100 divided by 5. You have 20. Cross multiplication. That's what I will do. So I'll read the question. I read the question very well and know which one I'm going to equate to the other. The unknown to equate to the other, cross multiply and get my answer. You can do that. And you can as well learn the formula. So I'm going to send it to the group. Please, if you are not yet on the group and you are opportune to be watching me right now, please click the link in my bio. You will see F.A.B Nursing Masterclass link there. Click on it and join the group. I would be resending past questions to the group after the live stream, and I'll be sending this detailed explanation on dosage calculation too as well. Now, the next part is community health nursing. These are another area that questions on paper one can be asked. Now, community health nursing, what you need to know, fundamental principles of community health nursing and the diverse roles of nurses within the community health framework. Know the basic concept of community assessment, health promotion, and disease prevention strategies. With um the previous thing I mentioned, where I mentioned disease prevention strategy, you can make use of this here. Health promotion from the word areas to promote health. So if you see a question, you can use your critical thinking to like, okay, I'm to promote health in this place. Read the question, read the option. Which option best promotes health in this area? Pick your answer and then you move on. The next one is home health care. For home health care, it's just most most questions too is case scenarios. How do you prevent hazards in home environment? How do you work with other healthcare personnel to provide optimal care for the patient at home? Now, we're almost done. The next one is healthcare quality improvement and patient safety. Now, here, quality improvement and patient safety questions were a lot. How do you improve the quality and safety of patients? Real life scenario question, which needs your critical thinking. So you see questions like this and then look at it, which one best improves quality and safety of the patient, and which one prevents infection and risk management. All of this will be put into use. So lastly, for paper one, principles principles of management and teaching. This is quite bulky, but the two major areas that I've noticed that questions have been asked from are basic management functions and leadership. So, what are the basic management functions? We have planning, organizing, directing, and controlling. Most times, it can be asked what's the first step in management function. That's the planning. So, the different leadership styles and how they impact healthcare too. You should know it. There's laissez-faire, there's democratic, there's autocratic, and all of that. How do they affect healthcare? The thing about these questions are it won't be asked directly. You'll be given case scenarios, or the questions can be asked in a tricky manner for you to read and understand and then know what exactly you are being asked before you give your answers. So that is all about areas that you can be asked questions in paper one. I don't know if anybody have questions, you can ask in the comment section. Let me check. There is no question. Okay. I want to believe that with everything I just said, I've been able to give you areas where paper one questions can be asked, areas under each of these courses that questions can be asked. Gave you samples how questions are asked, like in anatomy of physiology, where I mentioned the diagram, where I mentioned case scenarios and what you would do if you're placed in that situation as a nurse, and have been able to tackle all of that for paper one. So paper one is not hard, guys. It's very easy. Now, for those that are currently not watching, I'm going to be leaving this for a while on my platform for you to like get back to, because I understand that because from the concerns from the group, those that joined the group was that they might not be able to be watching it as it's happening live. So because of that, I'm going to be leaving it for a while. But with time, it's going to be pulled down. Now, I mentioned ebook earlier. Yes, there is an ebook that we're currently working on to put this into like more detail. What I basically just explained is going to be there. So to have access to it, you're going to pay a token of 10,050 naira. The the ebook is almost done. It's about 25 pages. I really wish I can present it, but for some reasons I'm not able to. It's just like accepting for you to see what I'm talking about. Talking about what I just finished talking about, which is paper one. Paper two that would be live later on this evening is there as well, and what is going to be explained is going to be there. Then tomorrow where we have Viber, we literally have everything on like areas that whatever questions can be asked for. Let me give you tips models, instruments, drugs, your project, your case study. These are like five major areas that questions can be asked from for your Viva. Now, for those models, you listed out common models for that are majorly seen, then for and how you are going to answer these models. Like you said the name of the model. I'm not going to give you all of it now because it will still be talked about tomorrow. But what I'm basically saying is that this ebook is more comprehensive. This life is to explain this slide that I'm portraying in details. It's still the ebook that is our guide. So if you want to possess this ebook, it's just a token of 10,000 €15. You can pre-order. It's going to officially be out after the end of the master class. Thank you for watching. God bless you. If you haven't subscribed yet, please click on the subscribe button because there would be more aside from this master class. Procedures. I'll be sharing procedures for literally all procedures, all nursing procedures, all midwifery procedures later on for midwifery students, all public health procedures with time, demonstration with time, just give me time, and good quality food and resources, which is like the equipment to use to demonstrate this. So once I have access to all of this, I would soon start uploading procedure videos. So if you don't want to miss out on any of this, please click on it. And for those that are no longer that are done and are looking for internship tips, what to prepare for, to carry for internship, to apply for it, how to prepare for internship interviews or exams, most likely question. Believe me, I've done a lot of applications. I'm talking about more than 15 applications. I've done about four different interviews and two exams. Yes. So I've completed enough, I've completed enough for me to share to my audience. With due time, you will see. So I'm talking about those that would need that. If you are watching this, you can subscribe as well. Thank you. Okay, I just saw a question. Is explicit textbook PDF available? Uh, I will check. I will check. And once I see, I'm going to send to the group. So if you're not on the group, please join the group through the link. Because I have mine as hard copy. I don't have soft copy. So if I see, I'm going to share. All right. Thank you and God bless you. Don't forget to subscribe, like this video, and share. It's still going to be here for a while. Thank you very much and God bless you for your time.